Dr. Kumar, could you briefly introduce yourself to our audience?
My name is Dr. Rajeev Kumar and I'm a professor of urology at the All India Institute of Medical Sciences in New Delhi in India.
Okay, could you kindly review the surgical management of patients with adrenal masses?
So most adrenal masses will need to be evaluated further to decide whether they are functional or malignant. Lesions which are functional or lesions where there is a suspicion of malignancy will typically need surgical removal. A lot of adrenal lesions are detected incidentally because of routine abdominal imaging, and a majority of these lesions do not need surgery. So the initial detection of adrenal lesion requires further workup before you decide whether to remove them or not remove them.
What do you think is the best management for incidental adrenal masses?
So if the adrenal mass is small and non-functional, you can probably just observe the lesion and not operate. However, if the lesion is functional, which means it's producing either catecholamines or cortisol or aldosterone, or it is a functional lesion basically, or there is suspicion of malignancy or it is large, then you need to do surgery to remove it. Those are the two basic managements.
Okay, what's your perspective of minimally invasive treatment of adrenal cancer?
Adrenal tumors primarily are operated laparoscopically, which means by a minimal invasive approach. Cancers in the past were not operated laparoscopically, and there used to be a belief that you should do them through open surgery. But of late, we don't accept that premise completely. And if the tumor can be completely removed without any breach, with a minimally invasive approach, we would do it, even if it's a cancer.
Okay, and do you think obesity and diabetes will affect the surgical outcomes?
There is data, including some data that has been presented at this AUA meeting, which suggests that patients who have diabetes or who are obese have poorer outcomes and are more likely to have complications. However, despite the increase in complications, the presence of diabetes or obesity is not a contraindication to surgery. In fact, some of these patients may be the ones who are most likely to benefit from surgery. So all such patients, if a surgery is indicated, should have the surgery.
Is there any clinical practice guideline for adrenal masses?
Yes, so there are clinical guidelines for adrenal masses. Primarily, these are guidelines on evaluation of adrenal lesions. So what these guidelines basically do is tell you what is the extent of evaluation and which tumors or which lesions should be operated. So yes, there are guidelines which are widely available which should be used.
Okay, do you have any suggestions to the young urologists for surgical management of adenocarcinoma?
Adrenal lesions are often managed by endocrine surgeons and general surgeons, apart from urologists. My advice to urologists, particularly the young urologists, is that they must continue to operate on adrenal tumors and not let these be taken over by general surgeons or endocrine surgeons. Adrenal surgery is a very satisfying surgery, laparoscopically or robotically, and I would suggest all young urologists should continue doing these operations.
Okay. Why do you choose to get into this field?
I chose urology because it's an area of interest for me in a surgical specialty, and I chose adrenal gland surgery specifically because it's a very pleasing surgery. It's a very gentle surgery, it's a very interesting surgery to do, and the outcomes are very good. So that's an important reason to operate on the adrenals.
Yes, I think so. If you're not to be a urologist, what would you like to choose as your career?
Well, my other interest actually is medical publishing. So I edit the Indian Journal of Urology, and So if I wasn't a urologist, I would probably end up being a publishing or an editor of a larger journal. That's probably what I would end up doing.
So it's the job of me.
Well, no, I'm not trying to take your job because I do not know Chinese at all or Mandarin. But yes, an area of medical publishing and editing is something what I would probably do if I wasn't a urologist.
Okay, it's really interesting. Nice talking. Thank you.
Thank you very much for the interview. Thank you.